For a closer look at this, we're joined now by Dr. James Talbot. He is the former Chief Medical Officer of Health for Alberta. He is also an adjunct professor at the University of Alberta. He joins us from Toronto today. Appreciate you taking the time. Thank you.
Thanks for having me.
I just wanted to start off by getting your reaction to the news today. How concerning is the loss of Canada's measles elimination status to you?
I'm saddened, and once I'm past that, I have a bit of anger. I mean, we took decades in this country to get to the point where we had eliminated measles, the deaths, the hospitalizations, the deafness, the mental health damage, and we kept those rates low to non-existent. They were low because occasionally there was an imported case, but it was rapidly discovered and the outbreak was brought under control, and we've squandered that in a year, where we've had sustained transmission, and as a consequence, today we have earned losing that measles-free status.
What is the consequence of having lost this measles-free status?
Well, I mean, first of all, in terms of the country, it's a wake-up call that we need to do better. And I'll get to the kinds of things that Dr. Bogoch was indicating in a moment. But what it also says is that we have done, let me just stop here for a second. The issue that we've had in that's led to the loss of the measles elimination is that since the 1920s, Canada has committed to international agencies, along with most every other country on earth, that when we have these communicable diseases, we will bring them under control, and if we fail to do so, we'll report. And that means that other countries can take proper precautions should that happen. And it means that if Canadians go to those countries, there may be restrictions placed on them. Similarly, those countries that have people to visit Canada also may have to take precautions, or their countries may not allow them to visit. And so there are two kinds of consequences to that. One is the loss of face. It's, as was already alluded to, that we're a rich country and we're admitting we weren't able to keep this thing under control, and the rest of the world needs to beware of our citizens and people traveling here. And then there's an economic consequence to it, because if you're going to put on a business conference, or you're going to have an academic conference, or you're going to have a sporting event, say minor league hockey international tournament, now the people who travel to those places are going to be advised that they're at risk of getting measles, and so there will be economic consequences as well.
Yeah, important consequences that you raised. Let me talk about the province where you're from. What are you seeing in Alberta right now in terms of what health services are telling the public about measles?
Well, from the perspective of physicians and healthcare workers, people have been saying since within the first couple of months of the measles transmission occurring that we needed to do a better job in 3 different areas. And that information was disregarded to the point where Alberta has 40% of the cases that helped us lose measles elimination status, and we have 10% of the population. And not to put too fine a point of it, the rest of the country, with the exception of Ontario, has done a pretty reasonable job of keeping control. So this isn't just an issue with misinformation. It also has to do with the strength of the public health system across the country, and in particular in Alberta and in Ontario.
So what do you think needs to be done?
Well, 3 things, and this isn't rocket science. The first is we need governments, particularly in Alberta and Ontario, to commit to a 5-year plan to get immunization rates to the 90% that they were at when we had measles eliminated. That protects the kids, and it also means that if new cases are imported, we have less chance of transmission. And that can be done within 5 years. You need a plan, you need the resources to do it, and then you need to be able to report yearly to the Canadian public, the Alberta public, what kind of progress you're making, what percentage you're at now. In parts of Alberta, in terms of regions, there's 50% immunization by the age of 5 in north, central, and south zones. It's higher in Edmonton and Calgary, but it's still 75%, which isn't enough. There are parts of Alberta in which the immunization rates are 10 to 25%, which is basically third world. So we have done better in the past. We were at over 90% before COVID hit. So we can do that again with a 5-year plan. The second thing, the most important thing, is to recognize that public health was hit extremely hard by COVID. There were people who were on the front lines 7/24 for the entire time. There's been a lot of burnout. There have been a lot of people who've been stressed out and left the system. And governments need to commit to strengthening public health so that contact tracing and that outbreak control that would allow us to get back to the measles elimination status is strengthened across the country as a whole. So 2 things. 1, do a better job on the immunization programs with a concrete plan. And secondly, strengthen public health to be able to ensure that everybody in the country is safe.
We're running out of time, but I do want to ask you about what you will say is misinformation and malicious information, right? About that's fueling vaccine hesitancy or vaccine skepticism, the anti-vax movement. How do you combat that?
Well, I think that has to be a part of a plan going forward. There have been people who have been researching this. I do want to make a distinction between the two. Vaccine hesitancy, every parent, I think, has a little hesitancy before they take their child in to be immunized. And we've dealt with that in public health since the beginning of immunization programs. So we need to make sure it's in a language they understand, that they understand the consequences, the lack of side effects, et cetera. What's new is malicious information. So there are people who are making money from clicks on the web, taking people to information that is just not wrong, it's actively harmful to them. And when you combine that with the people who are making money by putting forward fraudulent claims about things that can prevent the disease, that are not vaccine, or things that can cure the disease once you have it, then you have a recipe for disaster. You have both human and non-human actors. There are actually bots that do this, that are building up the clicks and making sure that you buy as much material that doesn't work as possible. And we need any strategy going forward also has to be able to deal with those malicious actors.
Dr. Talbot, appreciate your time very much. Thank you. Former Chief Medical Officer of Health for Alberta, Dr. James Talbot.